What if the blood pressure number your doctor has been chasing is actually wrong for your body? What if the goal that millions of seniors are being pushed toward every single year is silently causing falls, stealing memory, and in some heartbreaking cases, shortening lives? I know that sounds alarming. I know it sounds like it can't possibly be true. But I have spent years reviewing the research, sitting with the clinical data, and what I've found has completely changed the way I think about blood pressure in older adults. And in the next few minutes, I am going to share everything with you, because you deserve to know the real truth. I'm Dr. Claire Thompson, and I am here to give you the science that matters most. Everything I share with you today is grounded in peer-reviewed research, clinical trial data, and published consensus from some of the world's leading medical institutions, including findings from the American Heart Association, the National Institute on Aging, and landmark trials published in the New England Journal of Medicine. I don't want to frighten you. I want to equip you, because what I've seen in the research tells me clearly that the conversation most seniors are having with their doctors about blood pressure is deeply incomplete. And the information you are about to hear could be one of the most important things you discover for your long-term health. Let me start by painting you a picture. You are sitting in your doctor's office. The cuff tightens around your arm. The reading comes back at 138/82. Your doctor frowns slightly and says, "We need to get that closer to 120/80. You go home feeling worried. Maybe you increase your medication. Maybe you start skipping the salt shaker entirely. Maybe you feel dizzy when you stand up too fast. Maybe you even fall. And here's the part that breaks my heart. You think the dizziness and the fatigue are just part of getting older. You never once suspect that the blood pressure target itself might be the problem. This is happening to millions of older adults right now. And it is happening because a single number, 120/80, has been handed down like a universal law of medicine. A one-size-fits-all rule that ignores one of the most fundamental realities of aging. The truth is, your body at 65, 70, or 80 is not the same body it was at 35. Your blood vessels have changed. Your nervous system has adapted. Your kidneys process medication differently. And the pressure that keeps your brain and your heart fed with adequate blood flow is simply not the same number it used to be. Here is what is actually happening inside your body as you age. Think of your arteries like garden hoses. When you are young, those hoses are flexible and elastic. They stretch when blood is pushed through them, absorbing pressure like a natural shock absorber. But with age, something shifts. The walls of those hoses gradually stiffen. The elastic protein called elastin begins to break down. Collagen takes its place, and collagen is rigid and unyielding. Published research in cardiovascular physiology confirms that arterial stiffness is one of the hallmarks of aging and a primary driver of rising systolic blood pressure in older adults. Now here is why this matters so much. When your arteries stiffen, your body actually needs a slightly higher pressure to push blood efficiently up to your brain, especially when you are standing upright. Your brain sits at the top, and gravity is working against every single heartbeat. When medications force that pressure too low too quickly, your brain can experience something researchers call cerebral hypoperfusion. In plain language, it means your brain is not getting enough blood, and that can show up as dizziness, confusion, fatigue, or even increased risk of cognitive decline over time. This is not a fringe idea. This is published science from neurology and cardiovascular journals. On top of this, there is something called baroreceptor dysfunction. Your baroreceptors are tiny sensors inside your blood vessels that act like automatic pressure regulators. When you are young, they respond lightning fast to sudden changes in posture. As you age, these sensors slow down considerably. So when blood pressure is already being pushed low by medication, and your baroreceptors cannot compensate fast enough for a sudden change in position, the result is a dangerous pressure drop the moment you stand. Medical literature calls this orthostatic hypotension, and it is one of the leading causes of falls and fall-related hospitalizations in older adults. Every year, falls send hundreds of thousands of seniors to emergency rooms, and many never fully regain their independence afterward. This is the missing conversation. And I need you to keep watching, because what comes next changes everything. Before I go any deeper, I want to take a quick moment. If this information is already opening your eyes, Please hit that subscribe button right now and drop a comment below telling me what country you are watching from. I have people joining this community from all over the world. We are building something real here together, a family of older adults and caregivers who refuse to accept incomplete medical advice. So subscribe, leave your country in the comments, and let's keep going. Now, let me tell you about the real truth hiding inside the latest science. For a long time, a landmark clinical study called the SPRINT trial was used to justify aggressive blood pressure lowering in adults over 50. And to be fair, SPRINT did show real benefits. Intensive control of systolic blood pressure below 120 reduced cardiovascular events and deaths in a broad adult population. That is legitimate science. I am not dismissing it. But here is what the headlines never told you. The SPRINT trial specifically excluded frail elderly adults, people with diabetes, and people who had already had a stroke. These are exactly the groups that make up a huge portion of the senior population. And subsequent research focused specifically on those excluded groups told a very different story. Multiple large analyses of older adults, including data from thousands of seniors over 75, have revealed something researchers describe as a U-shaped relationship between blood pressure and survival. If blood pressure is too high, the risks go up. Stroke, heart attack, kidney damage. We all know those dangers. But when systolic pressure drops too low in older adults, especially below 120, the risks rise again on the other side of that U-curve. Falls increase, hospitalizations increase, cognitive decline appears to accelerate, and in some frail older populations, mortality actually rises compared to those with moderately higher readings. This is not radical. This is the direction that international medical bodies are moving. The European Society of Cardiology and the American College of Cardiology both now acknowledge that blood pressure targets for older adults should be individualized, not stamped with a universal number. The most current guidance from major institutions recognizes that for many older adults, a systolic reading in the range of 130 to 140 may represent the genuinely optimal zone, not a dangerous deviation from normal. And now let me walk you through the 5 most important truths about blood pressure in older adults, because each one builds on the last, and together they form a complete picture that every senior deserves to understand. Truth number 5 is this. The 120/80 target was never designed with your aging body in mind. When the original blood pressure guidelines were established, the research base was largely built on middle-aged adults. Fit, relatively healthy adults without the arterial changes, the multiple medications, and the postural challenges that come with advanced age. What researchers discovered over time is that a number perfectly safe and beneficial in a 50-year-old can carry very different consequences in a 78-year-old with stiff arteries and a sensitive autonomic nervous system. Research published in respected geriatric and cardiology journals found that in adults over 75, pushing systolic blood pressure below 130 was not consistently associated with better outcomes, and in some subgroups was linked to worse survival compared to moderate control. The lesson is not that blood pressure doesn't matter. It matters enormously. The lesson is that the right blood pressure is not the same at every age. Think of it like shoe size. A size 10 shoe is perfect for one person and crippling for another. Applying a universal blood pressure target to every older adult, regardless of health, fragility, or physiology, is the same kind of mismatch. Your age, your frailty level, your medications, and your overall health status are the variables that should shape your target. And the sooner both you and your doctor have this conversation, the sooner your blood pressure care can actually work for your body instead of against it. Truth number 4 is something I want you to really sit with. Your arteries are telling a story about your age, and that story demands a different standard. As collagen replaces elastin in your vessel walls, your arteries lose their ability to act as pressure buffers. Every heartbeat generates a higher wave of pressure because there is less give in the system. This is why isolated systolic hypertension, where the top number rises but the bottom number stays relatively normal, is the most common form of high blood pressure in adults over 65, according to the National Institute on Aging. It is not a disease you caught. It is a biological adaptation of aging, and the way you respond to it needs to reflect that reality. When doctors treat this adaptation too aggressively, they can push the diastolic reading dangerously low while chasing a normal systolic. Your diastolic pressure is what fills your coronary arteries during the resting phase between heartbeats. Research consistently warns that when diastolic drops below 65 to 70 in older adults, the blood supply to the heart muscle itself can be impaired, potentially increasing the risk of silent cardiac events. So while doctors chase a low systolic, the real danger may be lurking in a diastolic that has been pushed too far down. Elena, a 74-year-old former school principal, had been medicated to a systolic of 115 for 3 years. She felt exhausted constantly. Her diastolic hovered around 58, and her doctor kept saying everything looked perfect on paper. After working with a specialist who understood age-adjusted targets, her medications were gently reduced. Her systolic settled into the low 130s, her diastolic rose to 72, and within 2 months, she described feeling like herself again for the first time in years. Truth number 3 brings us to one of the most underappreciated dangers in senior healthcare: orthostatic hypotension, which means a sudden drop in blood pressure when you move from lying or sitting to standing. Research published in geriatric medicine journals confirms that a drop of 20 or more points in systolic pressure upon standing, or 10 or more points in diastolic, qualifies as orthostatic hypotension. In a healthy younger adult with flexible vessels and sharp baroreceptors, this rarely happens. In an older adult whose vessels cannot flex quickly and whose pressure sensors respond slowly, this can happen every single time they get out of a chair. The result is an immediate reduction in blood flow to the brain, producing dizziness, a brief graying of vision, or unsteadiness, and within seconds, a fall. Research from the American Heart Association confirms that orthostatic hypotension is a significant independent risk factor for injurious falls in older adults. Hip fractures and head injuries are consequences that can be life-altering. The bitter irony is that aggressive blood pressure lowering with medication is one of the most common triggers. This is precisely why modern geriatric guidelines emphasize orthostatic blood pressure testing as a critical part of managing blood pressure in seniors. If your readings drop dramatically when you stand, your blood pressure target may need to be adjusted upward, not pushed lower. Truth number 2 is one that I find both fascinating and deeply important for your long-term brain health. There is a growing body of research connecting blood pressure pushed too low in late life to an elevated risk of cognitive decline. Your brain is the most metabolically demanding organ in your body. It needs a constant, steady stream of oxygenated blood to keep its billions of neurons functioning normally. When systolic blood pressure drops chronically below certain thresholds in older adults, cerebral perfusion becomes compromised. Your brain starts running on slightly less fuel than it needs. Research published in peer-reviewed neurology and hypertension journals has linked this cerebral hypoperfusion to accelerated loss of white matter, the connective tissue of the brain, and to increased markers of Alzheimer's-related pathology. And this is where it gets even more important. One long-term study found that high blood pressure variability in late life, where readings swing dramatically up and down, was associated with significantly higher dementia risk. This means stability matters just as much as the number itself. Erratic swings caused by overmedication can be as harmful as chronically elevated pressure. The sweet spot for brain health is steady, moderate control within a range appropriate for your age, not a dramatic plunge to the lowest possible reading. Marcus, a 78-year-old retired firefighter, had been experiencing episodes of confusion and short-term memory lapses for over a year. His family feared early dementia. His systolic had been pushed into the low 110s on high-dose medication. When a geriatric specialist adjusted his targets and reduced his dose, his systolic settled around 136. The brain fog began to lift within weeks. His family said it was like getting him back. And now we arrive at truth number 1, the most empowering piece of this entire conversation. Your personal optimal blood pressure is not a universal number. It is a range that belongs specifically to you. And you can actively support it with evidence-based lifestyle changes that science has proven to work powerfully in older adults. If you are between 65 and 74, healthy and relatively active, Current evidence suggests a systolic of 130 to 140 with diastolic of 70 to 85 is associated with the best outcomes. If you are between 75 and 84, a systolic of 135 to 145 with diastolic of 70 to 85 balances cardiovascular protection with fall and perfusion safety. If you are over 85 or frail at any age, a systolic of 140 to 150 with diastolic kept above 70 often delivers the best quality of life. These ranges reflect the convergence of geriatric cardiology guidelines and individualized care frameworks endorsed by the European Society of Cardiology and the American Geriatrics Society. Now here's the beautiful part. Your lifestyle choices have enormous power to move your blood pressure into that optimal zone naturally. Clinical trial data from the landmark DASH diet studies shows that following a diet rich in vegetables, fruits, whole grains, and low-fat dairy while meaningfully reducing sodium can lower systolic blood pressure by as much as 8 to 11 millimeters of mercury. A study published in JAMA found that reducing sodium intake by just 1 teaspoon a day produced an average 8 millimeter drop in systolic pressure in over 70% of middle-aged to older adults. That rivals what some medications achieve, with no side effects and no risk of dizziness on standing. Research from the University of Connecticut found that simply adding 3,000 steps to your daily walking routine produced a meaningful, measurable blood pressure reduction in older adults with hypertension. Not a marathon, just a consistent daily walk. Potassium and magnesium, found naturally in bananas, leafy greens, sweet potatoes, and nuts, work directly on the mechanisms that regulate vessel tension, and multiple cardiovascular studies confirm their protective association with lower blood pressure. And if you snore heavily or have been told you stop breathing during sleep, please take that seriously. Obstructive sleep apnea creates nightly blood pressure spikes that make hypertension extremely difficult to control. Treating it can produce remarkable improvements in your overall readings. Now, I want to be completely transparent about who needs to be especially careful, because your safety matters more than anything else I could share. If you are currently taking blood pressure medication, please do not change your dose or stop taking it based on anything you have heard today. Abruptly stopping blood pressure medication can cause a dangerous rebound spike that raises your risk of stroke. Any adjustments must always be discussed with your doctor. If you have diabetes, a history of stroke, or coronary artery disease, your targets may be somewhat lower, with a systolic closer to 130 to 135, still with close monitoring for orthostatic symptoms. If you have kidney disease, discuss your targets carefully with your specialist, as the relationship between pressure and kidney protection is highly individual. If you experience dizziness or unsteadiness when standing from a chair, tell your doctor immediately. Do not dismiss this as normal aging. It signals a potentially dangerous drop in standing blood pressure that needs clinical attention. If your systolic is consistently above 160 or your diastolic above 100, see your doctor without delay, as those levels carry serious cardiovascular risk. And if you ever see 180 systolic or 120 diastolic or above, that is a hypertensive crisis. Go to the emergency room immediately. So here's what I want you to do starting today. Get a home blood pressure monitor if you do not already have one. Check your blood pressure every morning and evening for 2 full weeks and write down every reading. Home monitoring is more accurate than office readings, which can be inflated by what clinicians call the white coat effect. Next, do the standing test. After sitting quietly for 5 minutes, take your blood pressure. Then stand up and take it again after 1 minute. If your systolic drops 20 or more points, or your diastolic drops 10 or more points, bring that finding to your doctor right away. Then bring your home log to your next appointment and ask this specific question. Given my age and health, what is my personalized blood pressure target, and are we monitoring for orthostatic hypotension? That single question can shift the entire dynamic of your care. Beyond that, start walking a little more each day. Reduce processed foods that are high in sodium, and add 1 potassium-rich food to your daily meals. Small, consistent shifts compound powerfully over weeks and months. Give these changes 3 to 6 months of consistent effort. You will not see a transformation in a week, and anyone who promises you otherwise is not being honest with you. But research consistently shows that older adults who combine targeted lifestyle shifts with properly calibrated medication achieve the most stable and protective blood pressure outcomes. The goal is not the lowest possible number. The goal is the right number for your body, steady and supported, keeping your heart strong, your brain sharp, and your feet firmly beneath you. Here's what I need you to carry with you from everything we have explored today. The best blood pressure for you as an older adult is not a one-size-fits-all target handed down from guidelines written for younger bodies. It is an individualized range that respects your aging arteries, protects your brain's blood supply, and keeps you safe on your feet. Too high carries real dangers, but too low, especially in the senior years, carries dangers the mainstream conversation has been far too slow to acknowledge. You now know the full picture. If this video helped you today, type the word YES in the comments right now. Your comment helps this message reach more seniors who need to hear it. Share this video with someone you love who is over 60 and taking blood pressure medication. Hit the like button and subscribe so you never miss the information that could genuinely change your health. You are not just a number on a cuff. You are a whole person with a unique body, a unique history, and a unique path to your best life. Every week on this channel, I bring you the kind of honest, research-based information that your health deserves. I am here for you, and I am here every single week to help you walk that path with confidence, with clarity, and with the truth.